Hurricane Ian has also impacted healthcare facilities across the state, making it very difficult for medically vulnerable people to get the care they need. For more on that, I'm joined by Tom Cotter. He's the president and executive director of Healthcare Ready, which is a nonprofit that coordinates public, private, and government responses to disasters. He joins me from just outside a shelter in Fort Myers. Tom Cotter, thank you so much for being here. I know that there is a lot of need amongst a lot of different people in Florida right now. But on the healthcare side that you particularly focus on, can you give us a sense of what you're hearing from people? What are the most acute needs right now?
Well, right now, people are either in shelters or trying to rebuild their homes. And as in all disasters, the people with hypertension still have hypertension. The people who go to dialysis still need to go to dialysis. And making sure that that supply chain and that access to healthcare is available to the people who need it most is our number one objective right now. And that's all complicated by the impact of Ian on the regular infrastructure around here, power and water.
So what is it that those people can't get to the facilities because the roads are impassable or those facilities themselves were damaged? Where is the hang up?
Well, right now, all of the healthcare facilities, all of the pharmacies, dialysis centers are all working very hard to open back up. But it's really tough if you don't have grid electricity and you need to run a generator. You need to have fuel for that. It needs to not break down. And so there's a lot there. The roads and infrastructure for travel are relatively okay, give or take. But the biggest challenge right now is just having these companies that are trying to get back up and running and provide the service. It's tough without any support from the grid or from the water. It's doubly so for hospitals and other clinics because they rely on enormous quantities of water to provide healthcare services.
And so, with regards to what your organization does, what kinds of help are you providing while you're there?
Well, right now we're talking to private sector businesses that are working to get up and running, getting them what they need in terms of generators, other supplies. Even staffing is an issue because the people in this area that work at CVS, that work at Walgreens, that provide nursing care, they were all impacted by this storm too. So trying to meet all of the needs of that to get this infrastructure back up and running. In addition to that, working with all of the NGOs in the area, Heart to Heart International, Project Hope, AmeriCares, to make sure we're matching needs to resources as they become available. So really tackling this from every angle.
And do you have a sense of when some of those issues will start to be resolved?
They're being resolved very quickly in the surrounding areas of Lee County. Right now, I drove through Naples, Florida, where I was pretty shocked to see pharmacies open, gas availability looked good. But in the hardest hit places, that's where we're very concerned. Places, Pine Island, Sanibel Island, there's people out there who need healthcare and are either still there or have become recently homeless, and that is a challenge unto itself to figure out how we can provide some stability as as an entity for their health and well-being.
All right, Tom Cotter of Healthcare Ready, thank you so much for being here and good luck with your work down there.